Hi everyone, this is Danielle Cavazos, and I chose to do my research on music therapy in the Neonatal Intensive Care Unit. And there's a couple reasons that I chose this diagnosis. The first is that it was my first real exposure to music therapy. I was doing some reading during my undergraduate studies, and I sort of came across music therapy in this context. So it was my first real reading about or experience with how this might be helpful for people's lives, and it sort of inspired me to study it in the future. And then in addition, I have a close friend who had a personal experience with a condition called preeclampsia, which I'll talk a little bit more about later, but it caused her daughter to be born preterm, and I got to see her struggles with attachment and regulation and sort of the things that families go through when dealing with birthing a child preterm. And she did not have any experience with music therapy, but through this I'm sort of seeing how music therapy could have been really helpful for her. So we're going to watch this quick little video clip that tells you a couple of the ways that music can be sort of effective for preterm infants.
Time, which is what makes it so unique. So music has the ability to calm while also activating areas in the brain. We are teaching premature babies how to regulate what is happening when they get a bath, when they're being held, when they're seeing lights and hearing sounds, because music is calming. It automatically calms them and helps them see pleasure in what's happening around them. And then they're able to tolerate whatever the next thing in their schedule is better because they've now experienced this.
Michael,
So to talk a little bit more about the diagnosis, any infant born before 37 weeks is considered preterm, but there are subcategories. So less than 28 weeks is considered extremely preterm. An infant born between 28 and 32 weeks is very preterm. And then 32 to 37 weeks is considered moderate to late preterm. And the way this kind of shows up in the infants when they are born preterm is a lot of different ways. So they have neurodevelopmental symptoms, excuse my alarm, which affects their nervous system and sensory development. So those things are things that are still developing while the baby is in the womb, but when they are born early, it gets a little bit interrupted. In addition, they have struggles sometimes with attachment or family development, or other social emotional symptoms due to the preterm birth. And then there's also a lot of physical symptoms. So infants may appear different. They may have respiratory function issues due to their lungs not having been fully developed before birth. They often have increased heart rate. Brain physically may be abnormal, and they often have gastrointestinal problems as well. Medline.gov here gives a pretty extensive list of known causes for preterm infancy. So a weakened cervix could be a cause. Birth defects of the uterus of the mother. Just having a history of preterm delivery can also cause this. Infections can cause preterm birth, so urinary tract infection or infection of the amniotic membrane. Poor nutrition before or during pregnancy, preeclampsia, which is what happened with a friend of mine, which is high blood pressure and protein in the urine, and that develops usually after the 20th week of pregnancy. And premature rupture of the placenta obviously could cause premature birth. Mothers who are younger than 16 or older than 35 are much more likely to deliver an infant preterm. And use of tobacco or any other drugs obviously could be a cause for preterm birth as well. And non-musical treatment for infants in the NICU usually includes an incubator to help them regulate body temperature, constant monitoring of their vitals, nutrition through a feeding tube, or even in extreme cases, sometimes through a vein when they're unable to eat on their own at all. Most premature infants need oxygen of some sort. Some even need a ventilator in order to allow them to breathe. And there's often usually support groups as well for families, parents, anyone involved with the preterm infant. So music therapy can help preterm infants in a lot of ways. I think just like with any other diagnosis, there's a lot of different angles from which you can attack trying to improve the lives of these infants and their families. But a few different ways that it can be helpful is live music therapy. So Arnon et al., a bunch of researchers did a study about live music therapy actually compared to recorded music therapy. And in their specific study, it turned out that live music therapy was actually more effective in terms of physically reducing heart rates of babies, so calming them. And in addition to that, their research showed that parents and medical personnel both actually preferred the live music therapy to recorded music being used in therapy in that instance. So that's something exciting to look toward, that live music therapy might be actually more effective for infants in some cases. Music therapy can also be used to increase attachment. In these cases, it's often used in combination with other kinds of therapy or touch or movement. So in order to increase attachment between infant and mother and or father and or the rest of the family, or even to sort of initiate or begin building that attachment and relationship between the family and the infant. And then there's also sort of a more physical approach where music therapy can be used to help regulate those physical processes that premature infants often have struggles doing on their own. So helping to regulate feeding with suckling, which I think we all saw that video we shared between ourselves about specific suckling help, but also to reduce their increased heart rate, to help them regulate body temperature, to help them regulate breathing, and all the other regulation issues that sort of come along with being a premature infant. So in conclusion, music therapy is proven an effective method for improving health and the quality of life for premature infants and their caregivers, which I think is exciting for us. We've seen that there's a lot of different ways that it can work, and I'm sure that with more research, we'll find a whole lot of other ways that music therapy could be beneficial to the lives of these babies. Thank you guys for listening.